Support comes from Mosby Building Arts, a design-build company committed to remodeling the right way. Visit callmosby.com to get project inspiration for any room of your house.
From the St. Louis Public Radio Newsroom, this is The Gateway. It's Thursday, July 25th. I'm Wayne Pratt. Ahead, doctors are in short supply for pregnant women with drug addiction. Mothers and their babies are at serious risk without treatment, but pregnancy can be a powerful motivator to get help.
Now I'm living to give her a life, that a different life than I had.
St. Louis Public Radio's Sarah Fenton reports on a St. Louis clinic that combines neonatal care with opioid use treatment. First, the news. Metro East residents, along with drivers throughout Illinois, are paying more for gas. That's after a tax increase to help fund road projects kicked in this month. But as Mary Hansen reports, Illinois drivers probably will not notice any new improvements on roads until next year.
About a third of the new gas tax money goes to county and local road districts, and they'll start getting those funds in September. But it may be too late in the construction season to start new projects, as the bidding process can take more than a month. Brian Davis is the engineer for Sangamon County in central Illinois. He says a larger maintenance plan is in the works for next year for the area's highways and bridges.
We certainly have several miles of county highway that are starting to show their age, and this important tax increase would be beneficial for us trying to address those in a more timely fashion.
Statewide, the tax is estimated to bring in an additional $1.2 billion every year. I'm Mary Hansen.
The St. Louis prosecutor is asking for a new trial for a man convicted of murder and sentenced to life in prison. Circuit Attorney Kim Gardner's office wants that new trial for 45-year-old Lamar Allen Johnson of St. Louis. He was convicted of murdering Marcus Boyd in 1995. Gardner's office took another look at the case through her newly created Conviction Integrity Unit. A report from that unit claims police pressured and paid the only witness to that crime to identify Johnson, even though the two alleged shooters wore masks that covered most of their faces. Another man has since confessed in a sworn affidavit to the killing. A St. Louis police spokesman says the agency does not comment on pending litigation. A special Missouri House committee is going through public input about racial profiling of black drivers. As St. Louis Public Radio's Andrea Henderson reports, it was one of the main issues discussed during a hearing yesterday in the St. Louis County Council chambers.
State Representative Shamed Dogan and other members of the committee listened to testimonials from community members about interactions with police. The committee called the hearing to discuss the disparities between black and white drivers revealed in the recent vehicle stops report. They also examined police accountability and civil asset forfeiture. 84th District Representative Wiley Price is a member of the committee. He thanked constituents for attending and said he's concerned about how black drivers are treated in Missouri.
It's getting embarrassing to be in Missouri on several different levels.
Though most of the speakers highlighted negative interactions with law enforcement, Dogan says Missouri should look to cities and agencies that are reducing disparities between black and white drivers. I'm Andrea Henderson, St. Louis Public Radio.
Pregnant women need to stay healthy to keep themselves and their babies safe. That can be even more difficult for those struggling with drug use. As St. Louis Public Radio's Sarah Fenton reports, a local clinic wants to make sure moms with addiction get the help they need.
21-year-old B grew up in St. Louis. She started using opioids when she was 16. After moving around the country and trying to quit several times, she came back, hoping for a fresh start. But she had untreated mental health problems, and after a few months, she started using again. She had a chest cold one day and went to urgent care. A nurse called her over and said they needed to talk.
And I just didn't really know if it was true. It was really scary.
B was 14 weeks pregnant, and she was still using heroin and fentanyl.
I knew I wanted to be a mom for sure, but I didn't know how I was going to be able to do that when I was in the middle of a really dark time for myself.
We're not using B's name to protect her privacy. She knew she needed help for her baby and to treat her addiction, With her mom, she found a clinic at Washington University, which treats pregnant women with substance use disorder.
So I think it was about maybe 15 minutes later, I got a call back from the doctor that I still see now.
It was Jeannie Kelly, the medical director of the care clinic. It opened last year to help patients like B who need addiction treatment along with pregnancy care.
We wanted to create a one-stop shop for these patients.
Kelly says there's a shortage of addiction treatment for all people who need help, but that need is especially acute for moms. Some doctors drop their patients when they find out they're pregnant.
We've even seen patients who have had established relationships with doctors and providers who treat these disorders who then tell them when they're pregnant, we're no longer able to take care of you.
Every week, patients meet with specially trained neonatologists, counselors, and psychiatrists. They can get medicine like buprenorphine and methadone that helps manage addiction. Kelly says pregnancy allows doctors to help women who might not otherwise seek treatment.
And they're seeking medical attention, potentially for the first time in years. It represents this great opportunity to basically connect with these patients from the medical community.
She says patients with addiction are more likely to be dealing with other problems that keep them from going to the doctor and staying on track. That's where Brittany Vaughn comes in.
I am literally there for them all day. Like, some patients text me, some call me. I talk to each patient at least once a week.
Vaughn's official title is nurse navigator, but patients at the care clinic know her as a person who helps them get whatever they need. That could be helping them find housing, transportation, or getting insurance approval for their medicine. Sometimes she'll just listen.
They're used to being so judged that they think that everybody's judging them. So when they notice that myself and my coworkers, we don't, and we're really there to support them, that makes a world of difference. Like, you can tell when someone trusts you.
Vaughn was B's nurse. B was worried about what the neonatal intensive care unit was going to be like. About half of babies born to women at the clinic need to visit the NICU to get treated for withdrawal symptoms.
So that was scary. I've never, been in a NICU. I've never seen, little tiny babies in little boxes.
Vaughn arranged a tour of the NICU so B wouldn't be so nervous. That kind of support is important after women give birth, too. That's when the risk of relapse is the highest, and why the clinic psychiatrist sees patients for months after they deliver. But pregnancy is also a powerful motivator. That was true for B.
Now I'm living to give her a life, that a different life than I had.
She gave birth to her baby a few weeks ago. She says they're both tired, but they're doing okay. I'm Sarah Fenton, St. Louis Public Radio.
Our David Caceres edited this report. Shula Newman is the executive editor of St. Louis Public Radio. Music by Ryan McNeely of Adult Fur. If you like this podcast, tell a friend to give it a listen and make it part of a daily routine. I'm Wayne Pratt, and from the St. Louis Public Radio Newsroom, this has been The Gateway.
Support comes from Missouri Forest Products Association, committed to sustainable and sound conservation of the state's forests, which support more than 41,000 Missouri jobs, resulting in a $10 billion industry. ChooseWood.com.